So honoring your hunger would be honoring your biological hunger by feeding yourself every couple of hours. So it's okay to be mad at your body, right? A lot of our patients are mad because I know I personally have had people that say, I've done everything quote unquote right and this still happened, right? But just because we are mad or upset with our body doesn't mean we don't need to take care of it. Remember, you have to nourish yourself through this.
Good day, everyone. Welcome to the VoCP Talks, a platform to empower the cancer community. And our guest speaker today is Brittany Finley. She is a registered oncology dietitian. So, welcome to the VoCP Talks, Brittany. We'll get started with the question. So, what exactly was your professional background, and were you always a nutritionist? Also, what made you focus on oncology nutrition in particular?
Okay, so no, I have not always been a dietitian. I actually this is my second career. I was in the military and I was a dental hygienist of all things. I just always found nutrition interesting, so I decided to go back to school after I got out of the military. And I chose oncology because I had many family members who went through the experience of cancer. And I'd always been interested in it because I kind of inherently knew that I didn't want to do like weight loss. Like I knew that was not for me. I didn't want to focus on weight loss. And it kind of felt like a lot of dietitians were pushed that way in school because you're taught about weight loss. And I just knew it wasn't for me. So when I did my internship, because we all have to do an internship, I chose oncology as part of my internship. And it's just kind of been what I've done since then.
Really nice. You chose this path because of others.
Mm-hmm. Yeah.
So your bio mentions non-diet. Why is that important for cancer patients?
So a non-diet approach is looking at your food and the way you eat as a part of well-being and taking care of yourself compassionately instead of trying to be controlling and focusing on a way that you should look or a way that you could quote unquote eat. Instead of shoulding yourself, really just trying to take care of yourself and, ask yourself what sounds good to eat, what may help me feel better right now. So instead of focusing on the way you look or what you think you should eat, focusing on what you enjoy, what you can tolerate, things like that.
And intuitive eating is part of that.
Yes, so intuitive eating is a principle. I really like this quote, so I'm going to give this direct quote of what intuitive eating is. So intuitive eating is a style of eating that promotes healthy attitudes towards food and body, and it's a framework that helps you to tune out external messages and really integrate your emotions, your rational thought, and your own instincts. So it's using something we call interoceptive awareness, so learning our own cues. Like once we're kids, we know what we like to eat, right? You're not told what we have to eat. So really learning your own cues again and trusting your own cues instead of all of the things on the outside. So an example I can think of with a cancer patient is I had a patient who was really craving milk, and she's like, I'm not supposed to have milk. It's bad for, quote unquote, bad for me. And I was like, well, let's just try it. And she had the milk and it actually helped her to increase her appetite. She was tolerating it. So she listened to her intuition. So intuitive eating has 10 principles, and we kind of use those principles to help us learn to trust ourselves. So probably the biggest one and the one we start out with is rejecting the diet mentality. So in cancer care, the diet mentality I would think of is things like people telling you, well, sugar causes cancer, or you can't eat this, you can't eat that. So instead, pushing that off to the side and trusting yourself and saying, okay, I'm going to figure out what works for me. So the first step is to stop listening to what other people say, right? To learn to trust yourself. The second thing is honoring your hunger. So honoring your hunger is different for somebody who has cancer, depending on what stage of treatment they're in. So a lot of our cancer patients aren't hungry, right? You're going through treatments. A lot of us lose our appetite. So honoring your hunger would be honoring your biological hunger. And what I mean by biological hunger is that we know we're made up of these cells, right? And cells need certain things to survive: water, oxygen, nutrients. And we can't make the nutrients, so we have to eat them. So I talk to patients about honoring your hunger by feeding yourself every couple of hours, right? Maybe using a clock instead of trusting. And then after treatment, I work with my patients to figure out what your hunger cues are again. A lot of people don't even know what their hunger cues are, right? Number 3 is making peace with food. So not making food moral. An apple pie and apple are same morally. They are morally equal, right? You are not bad for eating an apple pie. You're not good for eating an apple, right? You need them at different times, or you want them for different times. Number 4 is challenge the food police. So telling people to stay off your plate. 5 is discovering your satisfaction factor. Can you make your food enjoyable? So a lot of times once we're going through chemo, food kind of becomes medicine and it's not fun. But is there a way for us to make this food fun again? Maybe you eat with friends. Maybe you sit down to eat instead of eating in front of the TV, right? So trying to make it pleasurable. Number 6 is feel your fullness. I don't typically work with that until after you've gone through treatment. Cope with your emotions with kindness. So can you deal with the emotions of cancer with something other than food? And it's okay to use food, but do you have other tools in your toolkit to deal with emotions? Like, do you have a friend you can talk to? Do you have a therapist that you're maybe working with, or a coach, a friend? So just finding ways to deal with your emotions other than food, but it's okay to use food. We just don't want that to be the only tool in the toolbox. Number 8 is probably one of my favorites, is respect your body. So it's okay to be mad at your body, right? A lot of our patients are mad because I know I personally have had people that say, I've done everything quote unquote right and this still happened, right? So it is normal to be mad or upset with your body, but just because we are mad or upset with our body doesn't mean we don't need to take care of it. So one thing that can kind of help is if you think of somebody you love, maybe your child, just because you're mad at them doesn't mean you're not going to feed them, right? It doesn't mean you're not going to take care of them. So I really like that principle. Then number 9 is movement, feel the difference. So can you move in a way that you enjoy instead of making it exercise all about, oh, I have to do this? Can it be fun? When was the last time you did something fun or something you enjoyed, like, I don't know, roller skating or going outside to play, just finding movement, right? And number 10, and this is the one that I think people tend to forget about, because we have to kind of go through all of those other things to get to this. But number 10 is honor your health with gentle nutrition. So just because we're eating intuitively doesn't mean we don't have nutrition knowledge, right? We still have nutrition science and we can use nutrition science, but we don't want to cloud it with so much diet culture. So that's why we have to think about getting rid of all the diet cultures and all the shoulds and things like that, and work through those other principles to really do gentle nutrition. So for instance, gentle nutrition would be for if we have a patient on oxaliplatin, which is a chemotherapy, right? I know as a dietitian that person is not going to be able to tolerate something cold because oxaliplatin makes you sensitive to cold, okay? So as a dietitian, I know that, and I say, okay, I can't give you anything cold, but this also might make you nauseous. So what's something that's quick that I can give you? Maybe I say, hey, you try a porridge or something like that, okay? We can still use our nutrition knowledge to help our patients, and we can also still use nutrition knowledge to take care of ourselves. The thing that I like to question people is it coming from a place of control or a place of compassion. Those are that's how you can kind of tell. So that was long-winded, but that's kind of the overview of intuitive eating and how it could
Yeah.
apply to cancer.
So if someone wants to practice intuitive eating, they can look through all these principles.
Right. And it's something that you can do through all stages of cancer, during treatment and after treatment. We just tweak things to kind of help.
Okay, so it's customizable as well.
It's definitely customizable. There's no one size fits all answer. This is why we like to work with people either individually or in groups, because no one thing works for every person. A lot of this is just getting us to think in a different paradigm instead of, oh, I need to be eating perfect because I got diagnosed with cancer. It's how can I eat to support myself through cancer?
So do cancer patients need to keep track of their calories? Like, do they have to eat a certain amount or not go beyond?
I would say no, and let me give you my reasons why. So once we look at a calorie on the back of a nutrition label on the back of food, they can be up to 20% wrong, right? And then all of our bodies absorb and use nutrients different once it comes to calories. I would just suggest not going on a low calorie diet. It is not the time to go on a low calorie diet. If I don't like the numbers, but I would definitely not go for most patients below 2,000.
So we often hear that things like processed food are bad, and are frozen foods or canned food also bad for cancer patients?
Okay, so frozen and canned foods are just as good as fresh. We want you to put those fruits and vegetables in you. I don't care if it's fresh, frozen, whatever. And processed is a very interesting word to me because I like to poke holes into it. All food is processed, right? Cooking is a process, right? Now, is it better to try and get more whole foods and, smaller ingredients, label lists? There is some benefit to that, but it's not bad. There's a difference between quote unquote ultra processed foods and just processing your own food. So I would say if you can tolerate it and it's the only thing you can tolerate during treatment, please eat it. It's better to have some nutrition than nothing at all.
So canned foods also fall into this category.
Right. Especially most labels, we used to be fearful of BPA. Most cans don't have BPA in them anymore. And with cans, if you're scared of that, you can just pour it into your colander and rinse it off. That can help. Yeah.
So you're saying there are no food categories that are completely banned, like a cancer patient must not consume?
No, there are a couple things that I would limit, but there are two things very specifically.
Okay.
If you can avoid alcohol, there is a definite link between alcohol and cancer. So limiting that is something I suggest. And the other thing you want to be mindful of, but again, all or nothing mentality is not a good thing, but are the processed meats like hot dogs, sausages, those types of things. There is a increased risk for colon cancer. So what we like to talk about is just limiting those.
Someone has a question. Can we eat food that we have frozen ourselves?
Oh, for sure.
So how can a cancer patient ensure a quick and smooth recovery with the help of the food they consume?
So the biggest thing is to make sure that you are staying nourished through treatment. So what I mean by that is kind of eating small, frequent meals and not losing too much weight too fast, because we know if we lose too much weight too fast, what tends to happen is that treatment can be delayed and it can cause problems, right? So I tell people once you're eating, keep it really simple. So eating every 2 to 3 hours and trying to have at least 3 things on your plate. Protein source. You need more proteins during cancer treatment because your cells are turning over so rapidly. So protein would be things like meat, eggs, plant-based proteins. And then the second thing you want on your plate is a fruit or a vegetable. And then a third thing would be your carbohydrate or starch, right? So a meal could be something as simple as chicken, rice, and asparagus or a peanut butter and jelly sandwich and an apple. Try not to overthink food during treatment. So just making sure that you're nourished, small, frequent meals, because the more nourished you are during treatment, the easier recovery is afterwards. And the other thing to think about is that even during recovery, you have increased nutrient needs. So meaning you have increased needs for protein, calories, and micronutrients like vitamins and minerals. So it's important to still eat. So don't go from, okay, I made it through treatment to now I need to restrict my food. No, most of us, there's at least a 6-month healing period where you still have increased needs.
What are food rules and how can they negatively affect someone?
So food rules are once we put those shoulds or should nots on food, like I should not eat this. This is not allowed. This is about bad food. Once we add that morality to food, food rules can get in the way of us nourishing ourselves during treatment. I've had a lot of patients tell me, well, I shouldn't eat meat once I'm going through treatment. And, you know, there's nothing wrong with being plant-based or being vegan, but knowing why you're doing it. Is this because you actually want to do this in a certain way, or is it because you feel you should? And there's a difference. And a lot of those people sometimes struggle to make it through treatment, staying nourished, because they've taken out this whole food group that they usually enjoy, and that's a quick source of protein. And now they're overthinking food, right? Which can be problematic.
So, what is cancer neuropathy and are there any ways to combat this?
So cancer neuropathy are once you feel those pins and needles in your fingers and feet. There is limited studies about cancer neuropathy that you can help with B vitamins. But the biggest thing is just staying nourished. But there's not a ton of evidence-based research as far as nutrition-wise to show that we can fix neuropathy through food. But the only thing I've seen so far has been that taking B vitamins, a B complex, can help for some people.
And another side effect of treatments is nausea. So, are there any ways you could reduce that or deal with that better through food?
Oh, for sure. So there's tons of foods that I like to use for nausea. So you can definitely use ginger. Another thing that people don't think about with nausea is if your stomach is empty, it tends to contract, and that can kind of be forceful, and that causes that dry heaving. So trying not to let your stomach get too empty, because once your stomach is too empty, that makes the nausea worse. So I tell people before, if you're having really bad nausea, before you rise out of the bed, have a few crackers to put something on your stomach. That can really help to settle your stomach. And taking your nausea medication, I know this is not food, but taking your nausea medication on schedule and trying to stay ahead of it. Because a lot of people will say, I don't like to take medicine, and then they end up chasing their nausea. And that can be problematic. So we want to take the medicine as prescribed on schedule, because that can help prevent the nausea. But the biggest things I've definitely seen help would be ginger. Ginger tea, ginger chews. I've even had patients, there's pregnancy pops. They use them for women who have nausea during pregnancy, but it actually works during chemo as well.
So, starving yourself, trying to not to throw up will not help.
That is going to make it worse, because your body is going to go, it's going to start contracting, and then you're going to feel nauseous, and you're going to feel even more nauseous, and you're going to feel weak, and you're going to feel tired. So I know it's easy for us to say, but it really does help if you can put something on your stomach. And you can even do, softer, more bland foods, like things like just toast or crackers. Keeping it real bland to begin with can help, or bananas and fruit.
The final question is, what type of non-diet advice would you give to someone who was recently diagnosed with cancer?
So probably my biggest piece of advice is saying, I want you to ask yourself throughout this whole process, how can I take care of myself? How can I nourish myself? So once it comes time to eat, ask yourself what sounds good. And if nothing sounds good, saying, okay, I know I need to nourish myself. What do I have that's easy or convenient? You know, it's really important to take care of yourself, kind of like we talked about earlier. Even if you're mad at your body, even if all of this is going on, remembering you have to nourish yourself through this. So that's probably my biggest piece of advice is that you deserve to be nourished. Your body deserves to be nourished. So make sure that you are nourishing yourself. And my second thing is ask for help. I know it can be a lot, especially when it comes to food, just brain power of thinking, what should I eat? When should I eat? Ask for help because people want to help you and they'll ask you, like, I don't know. We'll say, hey, can you make a meal for me? Can you do a meal plan for me? Can you bring something to me? Ask for help. Don't just suffer. And if you don't see a dietitian, make sure you seek one out because a dietitian who specializes in oncology can really help you through treatment. We know how to help with things like the nausea, the vomiting, the GI symptoms like diarrhea and constipation. We also know how to help with the things like the mouth sores. We can prevent a lot of things from happening if you see us early. So find your dietitian early and work with them. It's probably another big suggestion.
So, do you have a message for the cancer patients and survivors of our community here?
You know, a few big things that I want to scream at the top of my lungs is that sugar does not cause cancer. Sugar does not need to be feared. You are still allowed to enjoy food and enjoy life, right? So no one food causes or cures cancer. Please nourish yourself and enjoy food again. So you can use stevia to substitute sugar. It's a preference thing as far as I'm concerned. And what the research says is you don't have to change to stevia. Of course, you don't want huge amounts of stevia or huge amounts of sugar, but you can have either for sure. And there was one point that I just thought about is that try not to focus on your weight so much. Weight is not a moral issue. Weight is just data. I know it can be really jarring, especially for breast cancer patients, to go from don't lose weight, don't lose weight, don't lose weight to being told, oh, you've gained too much weight. There's an increased risk of cancer. You know, that's weight stigma, and just be mindful of that. Even we don't need to focus on weight so much. Okay.
So, thank you so much, Brittany, for joining us on today's live session on cancer nutrition. Your insights were incredibly valuable and are sure to have benefited many of the viewers. So, would you like to let them know how to find you on social media or get your services?
So they can follow me on Instagram at brittanyfinley.rd. There is, if you want to work with me, there is a link in my bio where you can just do an inquiry and I'll get back to you. Other than that, if you're more old-fashioned, you can email me at finleynutrition@gmail.com.
Okay, so thank you.